Afternoon, everyone. Fran and I want to extend our best wishes to the First Lady and to the President for a good recovery. We think about them. We think about everyone who is battling the COVID today across our country and around the world. I want to update everyone on today's data. As you can see, our deaths are at a very high rate. And again, I would remind everyone that the deaths that we report today, that came in yesterday, do not reflect the day of the death necessarily. It's the day that it comes into us. And so we never like to see these numbers high. This is a high number, but it does not necessarily mean that these were recent. It spreads over a period of time. Second, the case number at 1,495 is very alarming. That number now is this number, 21-day average, is now back over 1,000, and so we do not like to see that. We have seen in the last week our positivity numbers statewide ticking up as well. And the hospitalization numbers now, for the first time in a long time, are starting to go back up. Eric, if you could show the hospital numbers there. Let me just go to this first. This is our top 20 counties again, very similar to what we showed yesterday. Not a significant, obviously, change in one day. And these are the top 20. This is the top 88. And Eric, let's go to the hospital slide. A little explanation on the hospital slide. This area through here is considered incomplete. So these numbers continue to fill in. So what is concerning is we're seeing a significant increase, even though these are still filling in. So when you see that kind of go up rather dramatically, and we know that will continue to go up as more of those numbers fill in for those particular days. So we're concerned about that. Fran and I had a test about an hour and a half ago, and we do not have the results back yet. Happy to take any questions.
First question of the day is from Ben Schwartz at WCPO in Cincinnati.
Hey, Ben.
Excuse me. Hi, Governor.
Hey, Ben.
Do you believe average Ohioans will ever be able to be tested daily for COVID if they see fit, like the president's able to? And in light of this, President Trump testing positive, do you have any plans to test yourself more frequently for COVID-19?
Haven't really thought about myself or Fran. We felt we should take a test today. Yeah, Ben, I'm not sure I got the entire part of the first part of the question, but I think it was about availability of testing for the average Ohioan. Yeah. I think this is going to go up dramatically. I was on the phone about 2 hours ago with the head of Abbott Labs. They have produced these strips that we hope to receive in Ohio, the first batch of these next week. This is something that the White House signed a contract with Abbott Labs. These are quick tests. They are tests that are basically a strip so that they will be fairly readily available. So this is going to increase the testing. We think there'll be more of these come on the market. So yes, I think we're going to see in the next few weeks a significant increase. We're still looking at exactly how to deploy these tests, but we want to fill in whatever gaps we have left in nursing homes because this is the most vulnerable people in Ohio we have. But also these could be used to help kids get back in school quicker. that could be used at the college level as well. And there are other uses. So we're looking at an array of uses for these, but this will be the first tests that are like this, that are, as we said, sort of like pregnancy tests, that you can read them quickly. They do not have to go to a lab, and they're relatively cheap. So when we start buying these first tests that will receive, we hope next week, are free to Ohio. The federal government has paid for these. The White House has paid for these. Once we run through that, and that contract runs out, it's my understanding these are going to be at the cost, I think, of $5 a piece. So that will be the cost to us in the state. So they're going to be relatively cheap, and they're quick, and they're pretty accurate. So we're excited about that.
Next question is from Farnoosh Amiri at the Associated Press.
Hi, Governor. Thank you for taking the time today. I wanted to ask you, what are your concerns that pushback that we've seen since the pandemic began on coronavirus protective measures by some Republican lawmakers in Ohio and in other places, including some GOP governors who often seem to be following the president's lead, has sent the wrong message about how to approach the handling of this deadly virus that now we've seen impacts everybody, even the President of the United States?
Well, yes, even the President of the United States. I think this is a powerful reminder to us that we have to do the basic things. We have to wear a mask. We have to social distance. We have to be careful. We have to avoid big crowds. I mean, it's for all of us. I mean, look, it's you know, as careful as Fran and I have been, you know, this was a reminder to us as well. And I think it's just a reminder to everybody that this virus loves everybody the same, as Dr. Acton used to say, or hates everybody the same, but it does not discriminate, and it's going to go after anybody. And it's very, very contagious. So it I think is a powerful reminder for us to pay attention. The President of the United States can get this. The First Lady can get this. We can get it too, and we just got to be very, very careful.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor.
Hey, Andy.
When it comes to what we saw at the debate on Tuesday, we've seen pictures and hearing reports that there were many people in the debate hall who were not wearing masks, although it was mandatory. What do you think about the fact that people didn't wear masks, and does the state plan on fining the Cleveland Clinic for not enforcing the mask mandate?
Well, I was not in the hall, so I don't know first of all, I don't know what the facts are in regard to that. I will say about the Cleveland Clinic, it is a great institution, and I know the Lieutenant Governor has talked to the CEO today, so I'm going to reference Jon here in a minute. But, you know, I think they did a very, very good job and did what they could do. But, Jon, I know you had a statement you wanted to make, and also if you want to have any comments about Andy's question.
Yeah. Look, I was there for the entire day. To get in the debate hall, you had to have a test that came back negative for the virus. Everybody who got in had to have their temperature taken. Everybody who got in had to wear a mask. I saw, Andy, I saw almost everybody had a mask on inside the venue. I wasn't in a position I could see everyone, but everybody that was in my sight line had a mask on outside of the participants in the debate. Well, I know that there were a couple people there who may not have had. I thought the Cleveland Clinic did a really fine job, along with Case Western, at creating an environment that was as safe as you could make something like that. There were at least 6 feet between chairs. The people were very, everybody was very respectful for one another. I thought it was I thought it was as well done as you could do something like that. And so, you know, that would be my reaction to that observation, is that my personal experience of being there, I thought they did a pretty good job.
Next question is from Jim Province at the Toledo Blade.
Hello, Governor.
Hey, Jim.
Hi. Has the state noticed any kind of a link between any new cases that might be associated with the 2 rallies that the president had last week? Those would still be within the 14-day time frame. And can you tell me, I mean, how close were you to the president? Was he wearing a mask when you met with him? And were you wearing a mask?
Fran and I went on Air Force One after it landed. We went in the back, walked through it, went to the president's cabin, and Fran and I both had masks on, and president did not, as I recall. And your other question, Jim, had to do with the we don't. I've not been told that anybody out in the counties, as far as the local health departments, have picked anything up at this point. If they do, as far as from, you know, something coming from the rally, we certainly will tell you that. You know, this is a tracing operation, and you know, if something shows up, we certainly will disclose that.
Next question is from Laura Hancock at cleveland.com.
Hey, Laura.
Governor, I was just wondering, kind of circling back to the legislature, they're not required when they're in the state house to wear masks. And I was just wondering if this is reckless, especially since a lot of them have met the president in person and might hit home more.
Yeah, I mean, was that the end of your question, Laura? I missed the last part, I thought.
I'm just wondering if you think it's reckless that they're choosing not to mandate masks when they're in their chambers.
Well, look, it's a separate branch of government. They make their own decisions. But I think what this reminds us is that anybody that you come in contact may have the COVID, anybody, and that there's no one who is immune from it, that anybody can have it, and because of the fact that so many people we know have had it who didn't have symptoms or had very light symptoms, you have to literally treat everybody you come in contact with as if they have it. And again, if the President of the United States can have it, you know, that means anybody can have it. And so it is a reminder to us. And I would urge every one of our citizens, and I'm watching these numbers, as I said a moment ago, and I brought these numbers out today because it was such a huge jump in the number of cases, close to 1,500 cases, new cases, that frankly, I'm worried. You know, we were doing pretty well on many metrics, but I can see this trend now setting in. And we can stop this trend if we'll wear a mask. Please wear a mask when you're out there. You can stop it. We control this. This is not rocket science. This is not difficult. I mean, we know what works. Wearing masks work. Keeping distance works. Staying away from large crowds works. Not going in, even if you're with friends or with family, without mask on, and try whatever you're doing. You can still pretty decent weather outside, and you can, you know, do it outside. I mean, these are just basic things that if we execute on these, 80% of us, 85% of us will wear a mask all throughout the state of Ohio. We'll knock this thing down. And this is just a reminder, you know, when we approach someone or someone who's close to us, we have to assume that they could have the virus.
Next question is from Adrian Robbins at WCMH in Columbus.
Governor, thank you for doing this today. In light of the president's diagnosis and in light of the trend that you talk about we're seeing here in Ohio, Are you concerned about future campaign events over the next 4 weeks coming to Ohio? The Trump campaign says they may go virtual, but the vice president will continue to campaign, especially considering reports of rules not being followed at Cleveland Clinic and the large crowds and few masks we've seen at other events.
Look, we just ask everyone, be careful. That includes churches. That includes if you're going to a funeral. That includes if you're going to a political rally. Wherever you're going to, you just have to assume that there are going to be people there who are positive. And you have to treat it like that. And if you treat it like that, you're going to be safe. And so, you know, I think that candidates can have events with people there, but they have to be very careful about it. And we would just urge the social distancing. While the weather is still good, campaigns throughout October, candidates are used to doing outside events. You know, please do it outside if you can. And, you know, people should keep a distance when they're there. It doesn't mean you have to stop campaigning. It doesn't mean you have to, you know, curtail it down to a, you know, minuscule number of people. But just following the basic precautions is what we need to do. It's what we all need to do no matter what we're doing.
Next question is from Max Philby at the Columbus Dispatch.
Hey, Governor.
Max?
So 2 questions today. One, is the state of Ohio involved with any contact tracing efforts the White House might be conducting, given the president's diagnosis? And 2, following up on Adrian's question, given what you said about how it's impossible to know who has the virus and we need to just assume that everyone has it, wouldn't it be safer to just move all campaign events online for the time being?
Well, look, we're trying to learn to live with this. And I believe we can live with this if we're cautious. So just as we have said, here are the guidelines for high school sports. Here are the guidelines for this and that. Here are the guidelines for a restaurant. Here are the guidelines for a bar. If people will carefully follow the guidelines, we can live with this virus. And so I would not make an exception for campaigns and say campaigns should just, you know, be totally virtual. We're not saying that about other things in society. And you know, and virtually everything's open in Ohio. I know there's some restrictions. We have restrictions on bars. We've got some restrictions on restaurants as far as they got to be 6 feet apart, but there's no capacity limit. So, you know, virtually everything's open. And so, no, I wouldn't say that campaigns need to completely shut down. I just think they need to be careful. They need to be compliant with what we request everybody to do. And that is just be careful, keep that distance, wear a mask.
Next question is from Alex Ebert at Bloomberg.
Oh, let me just say, I did not answer. We are not, to my knowledge, involved in working with the White House on any contact tracing. If that's different, we'll put out a release on it. But I have no knowledge that we're doing that.
Good afternoon, Governor. Thanks so much for taking our questions. In the past, you've talked about messages you received from folks in the legislature and friends that were critical of mask mandates and other restrictions that you've imposed to tamp down the virus. Have you received any messages in the last few hours now that we've seen President Trump and First Lady Melania Trump contract the virus, and what have they been? Thank you.
Message from legislators?
Yes, sir. Message from legislators and those in your friend circle who have questioned your past steps.
I've not seen any, but I've not checked my text messages or emails for the last 2 or 3 hours. So I've had pretty nonstop schedule and haven't really looked at it much today. So I'm not aware of any.
Next question is from Josh Rutenberg at Spectrum News.
Hey, Governor, how are you?
Hey, Josh.
Hey, just had a question for you and also for a different question for the Lieutenant Governor. I'll start with you, Governor, to piggyback off of an earlier question when it had to do with Republican lawmakers. And you said that the other branch of government has their own rules and they can abide by them. But, you know, lawmakers in this state are still residents. So are you concerned that they are not setting a good example for the rest of their constituents and for the rest of Ohioans, that they are not wearing masks? And then Lieutenant Governor, for you, I understand that you might have gotten tested today. Are your test results available? And also you said that the Cleveland Clinic did everything that they could in a very fine way, but there are pictures there of people who were not wearing masks. So what do you have to say about that?
I'll start, and then we'll go to John. I would not assume that legislators will not in the future wear a mask. I mean, I don't think we should make that assumption. We'll see. John?
Yeah, I will say that, you know, I was there on Tuesday. Well, I know that there were, on occasion, I think I saw one or two people who didn't have a mask on. I can only say what I saw. And as far as the Cleveland Clinic doing their job, I thought that they and Case Western Reserve University did everything they could to get people to do the right thing. But as we've learned in life, you know, in trying to get them to do those things and to follow the rules, not everybody does it. But I can tell you that everybody that I observed did, that I observed for the most part. I mean, everyone that I saw as I sat there had a mask on. As far as me, I did have a test earlier today. I don't have the results back on that. I'm self-quarantined at home out of an abundance of caution. I did not come within 50 feet at minimum of the president or anybody that was part of the group. I guess it was one of those times that not having a good seat was a good thing. It was, but we're gonna, you know, wait until we get the results of the test, and until then, I'll just be at home.
Next question is from Jake Zuckerman at Ohio Capital Journal.
Good afternoon, Governor. Your administration declined to enforce mask requirements at the president's rally in September. Do you think that action or non-actions like that kind of muddle and confuse a public health message that people should wear masks? And on that note, are you considering expanding the mask order to include the State House?
No, I don't look, everybody around us is wearing masks. Everybody who works for the governor should be wearing masks. You know, what the other two branches of government do, I can't control that. But look, I want to just urge people again to wear masks. And, you know, the truth is, if you talk to scientists, you talk to people who understand this, if we could get 90% of the people to wear masks, and let the ones who aren't going to wear a mask not wear the mask, you know, if we could hit 90%, we would just, these numbers would not be what you saw today. They simply would not be. You know, this is pushing 1,500 cases for a day, and that is not good, and we're not headed in the right direction. So, you know, we've got to get control of this before we get into winter, because winter, the experts think, will be even worse. So we got to be in a better position. And again, I'll go back to what I said before. We're not asking people not to live, and we're asking them to figure out how to live with this virus. And the vaccine is coming. And, you know, when that vaccine comes, it doesn't mean we can stop wearing a mask. But when we get, you know, people vaccinated, significant numbers, then you're going to see, obviously, you're going to start seeing some changes. So, you know, look, there's hope out there. Sun's out. We're going to make it through this. But we've just got to have the discipline to do the essential basic things. You know, it's like in sports, a coach tells you, you guys just do the essential things. If you do the essential things in the sport, you're going to be okay. And that's what we've got to do. We got to do the basics.
Next question is from Chelsea Sick at WKEF in Dayton.
Hi, Governor. We had both President Donald Trump and Donald Trump Jr. here in the Miami Valley just within the last 2 weeks. And I talked to 2 local public health departments who say because of the exemptions for political events, the crowd size makes it nearly impossible to contact trace if they needed to. What would you say to those public health departments and the people attending these rallies? You know, this election season is, we still have over a month before Election Day.
Okay, I really apologize. I was not picking that up. I got the public health, I got the president here, but I didn't catch the rest of it. I'm sorry. Could you just say it again?
Yeah, that's okay. The crowd size, the public health department says that the crowd size, because of the exemptions, makes it nearly impossible to contact trace at these events if they needed to. What advice would you give to these public health departments and the people attending these rallies so early on in election season?
Yeah, I mean, what the health department told you is what they told you. Again, we hope in the future, we don't see crowds like that. We hope in the future we have distancing. But the truth is, we have very little ability, despite what we ask people to do. It still comes down to what people will do and what people are willing to do. And that's the situation we're in. And we're asked people to do these things. Again, I think this is a powerful reminder. What's happened to the president and the first lady is a powerful reminder of how difficult this is. And that this virus, is out there looking for victims. And so going into a crowd where there are a lot of people and there's no social distancing and people are not wearing masks is not good.
Next question is from Josh Swigert at the Dayton Daily News.
Josh.
Afternoon, Governor. As has been mentioned, the president was obviously in Cleveland for the debate along with Hope Hicks. And the day after the debate, Donald Trump Jr. visited Tipp City north of here, and there was a rally, about 400 people there, most of whom did not have masks on. Can you describe the public health effort underway to determine if any of these events led to a spread of COVID to the public or to any officials that they met with? And a second thing, just do you know when you or the Lieutenant Governor might have results from the tests that you took?
We'll make my results available. I'm sure the Lieutenant Governor will as soon as we get them back. The tracing is done at the 113 local health departments. So, if we're talking about Tipp City, we're obviously talking about Miami County. So, that's who leads that effort. I don't know what contact our team at the State Health Department has had with them, but I'll find out.
Governor, if I could add something, which, as an administration, we have encouraged people wearing masks everywhere, including at these rallies. I know that I've only been to one of them. I spoke and I stood up in front of the crowd and I asked them to wear masks both there and outside of there. So we've been pretty consistent about the value of this, and we know that people don't like to wear them. It's inconvenient, but as I always try to say, that when you wear this, it does show your consideration for each other, to make sure that we're taking care of one another. And I hope people can view it in that vein, that it's just a symbol of how a real, not just a symbol, but an act of courtesy.
Next question is from James Pilcher at WKRC in Cincinnati.
Good afternoon, Governor.
Afternoon.
Hamilton County, as well as some other counties in Southwest Ohio, have jumped back into the red category. Do you have any specific reasons, or do you know of anything that is causing that to rise? And do you have any other specific reasons that you can point to for the overall state high numbers? I can tell you that Kentucky has had 3 days of 1,000 or nearly 1,000 cases as well. Thank you.
Well, we talked a little bit about Hamilton County. I think we've got something up on the web about Hamilton County. But we are seeing if you look at the map, Western Ohio is the most prevalent area, literally starting from Toledo all the way down to Cincinnati. It probably is a number of things. We're starting to see, whereas in the last several months, we had a big number under the age of 30. We are now seeing those numbers higher age. What we don't know is whether or not this is just young people getting infected and then turning around and infecting an older person. And that was our fear, but we really don't have the data yet to tell whether that's really what's taking place. I mean, I talked to our data team yesterday before the press conference about that very specific issue. They could not tell me yet. And, the tracing that we do, many times, particularly when you have as widespread community spread as we have today, it's difficult for the tracers in the counties to come up with one particular place that person got it. So I don't have a great answer. I just can tell you what we're seeing. It's going up. And, we've seen this uptick in the upper Midwest, and we had avoided it so far. But, you're seeing, an uptick in Indiana. And as I said, the western part of the state is certainly worse than the eastern part of Ohio.
Next question is from Haley Nelson at WSYX in Columbus.
Thank you for the time. We've seen some leaders in other states, in New Jersey, for example, encourage folks who may have been at a political rally to get tested for COVID-19. Is that the same advice for folks here in Ohio who were at a rally or perhaps even the presidential debate, for example? Should they go out and get tested?
Yeah, absolutely. If you've been in a big crowd, you should get tested. I mean, we wish you hadn't been in a big crowd, but if you were in a big crowd, absolutely, I would try to get tested. Look, we put up on our webpage every day where there's free testing, and there's also other opportunities to get testing. But just from the National Guard, there are opportunities every day. Somewhere in Ohio, may not be close to you, but there's other places to get testing. They've got drugstores that are doing it now. So yeah, I would certainly want to get tested if I'd been in a big crowd. I mean, it's a matter of math. And it just, the more people you are around, and particularly if you're around people for a longer time. So you got two variables: number of people you're around, and then the length of time you're around those people. And, so a big crowd, big political rally, any kind of big event, you've got those things going against you. What you have going for you, I guess, is outside. But we know that while it doesn't, it's better being outside than inside, we also know that it certainly can spread outside and does spread outside.
Next question is from Tom Gallick at Gongwar.
Hi, Governor.
Hey, Tom.
You yourself earlier this year had a false positive test, and we don't know, but it seems like maybe some folks might have tested negative before the debate and actually had COVID-19. Are you worried that some folks across the state might lose faith in the efficacy of the testing system?
Well, I don't know what kind of tests were taken before people went into the clinic. And I know the White House did their own testing. The Biden campaign, my understanding, did their own testing. And then the clinic was involved in other testing. So you're out of my area there because I don't know what kind of testing it was. But I did spend some time this morning, as I said, talking about the new strip test, antigen test that's coming to Ohio and that we're going to be deploying. And I think if you look at the antigen test as a test that you would do potentially much more frequently. That is the idea with these tests. It is not the final diagnostic test, but it's pretty darn accurate. So we will deploy the antigen tests in what we think is a strategic way to do it, with the understanding that they are a different type of test than the PCR test.
Governor, next question is the last question of the day, and it belongs to Monica Castro at WHIO in Dayton.
Hi, Governor. My question is, are you concerned about contact tracing following the president's diagnosis and on the potential impacts it could have on campaigning during this election?
Well, look, I mean, it's going to have an impact on campaigning. It's going to have an impact on what each one of us does. You know, human nature is that if we know someone that has had something happen to them, it has more of an impact than if we don't know anybody who's had that happen. And so in Ohio, we've had more and more people who we know. I've had 2 friends die from the COVID. But if you know someone, it has more of an impact. Well, in the world we live in, everybody knows the president. They may not have met him, they may not know him personally, but you see him on TV every day. So everybody knows the president. So I think that, you know, what's happened tragically will get people's attention. And because they know the president, it's happened to someone they know. And that makes it more real. I guess we're out of questions. Thank you all, and barring some emergency, we'll see you all on Tuesday at 2 o'clock. Thank you very much.